Let's talk about Derek Carr's shoulder injury. So on Sunday, he was tackled, landed on the side, was in so much pain he was taken to the nearby hospital. So what we likely suspect is that they were concerned for a potential collarbone fracture that may have potentially punctured his lung. They were probably also likely concerned for the center of where the collarbone intersects with your sternum, called your SC joint, that might have dislocated and punctured a vessel of his heart, which is also bad news. So when we look at the shoulder anatomy, we have a couple different things that we're talking about, right? A lot of people are familiar with the glenohumeral joint, which is the ball and socket joint. What we're talking about, though, is more of where the collarbone intersects with the shoulder blade. That's termed the AC joint or the acromioclavicular joint. A lot of times these injuries are termed a shoulder separation. Basically, what happens is the most common injury is when an athlete gets tackled or slammed or lands on the side of their shoulder. All of that ground reaction force gets transmitted all the way from the tip of their shoulder all the way across through their collarbone. So what has to happen is one of really three things happens is either the collarbone fractures, and we can have a few different types of collarbone fractures, the AC joint gets injured, or in the scare that we had with Derek Carr is that potentially the collarbone sternum junction can become disrupted. In Derek's case, it looks like he just sprained the AC joint. So there are 6 different types of AC joint injuries or AC joint separations. The first 3 are managed non-operatively. So in a grade 1, those ligaments that are highlighted in red, they basically just get stretched out. The ligaments are rubber bands that hold the joint together. And so in a strong slam like what happened with Derek Carr, those ligaments presumably just got stretched out, which is why he's termed weak to weak. In a grade 2 and a grade 3, one or all 3 of those ligaments that are highlighted in red become torn. In grades 4, 5, and 6, you're looking at a more catastrophic injury, and those are usually managed operatively. Now, when we talk about Derek Carr specifically, what he likely had, given that he's termed week to week, is a grade 1 sprain, which means that likely the ligaments just got a small stretch to them. Usually pretty painful and more what we call symptom limiting, meaning it just depends on how hard he can push through. Given that he's an NFL quarterback and things are always seem like they're life or death week to week, right? Some things that they will likely do to manage it include giving him a pain injection into the AC joint, which is not recommended for non-athletes because that can mask any dysfunction and a lot of the pain that is protective. The other thing is that he may be walking around in a sling because gravity can pull the shoulder down, which can continue to pull on the top AC joint ligaments. The other thing is that there's going to be a lot of rotator cuff work that needs to be done to make sure that the ball and socket, the way that the shoulder joint moves, that scapulohumeral rhythm is preserved as well. So while Derek Carr is termed week to week, which is presumably a grade 1 shoulder sprain or basically a stretch of those ligaments, some things that are going to hold him back, like we mentioned before, are extreme pain, inability to tolerate certain positions to get into the throwing motion, and also it will also depend on his tolerance for potentially taking another hit to that same shoulder, landing on that side, which given that he's a quarterback and he's likely going to get tackled, sacked, or have some type of injury prone mechanism like that, it's definitely a real concern. So we'll see how the sports medicine team with the New Orleans Saints manage him.